Hi, this is Lauren Shields from Fox 47 News. I'm here with Andy Hetzel, Vice President of Corporate Communications at Blue Cross Blue Shield of Michigan. Andy, how are you today?
Hi, Lauren. I'm great. I'm at home with my family. My kids are in remote learning, and my wife is working from home. We are in, I guess, the new normal of COVID these days.
I can absolutely relate to that. I am also in my little home office, so it is the new normal, yes. So you've announced the extension of no-cost COVID-19 treatment. When will this cost now be waived through?
Sure. So Blue Cross Blue Shield of Michigan, since the early days of the pandemic back in March, has waived member cost sharing for any of our members that contract the COVID-19 disease and need treatment. What that means is that our members aren't paying co-pays or deductibles or co-insurance should they get the COVID-19 disease and need to go into the hospital. We did that back in March to provide a little bit more security for our members during an uncertain time. And with this latest wave of the pandemic, we felt it was important to continue to provide that sense of security all the way through March 31st of next year. So through March 31st of 2021, Blue Cross Blue Shield of Michigan and Blue Care Network members, should they contract COVID-19, can rest assured that they will not have cost sharing associated with their treatment.
That is great news, I'm sure, for those who have Blue Cross Blue Shield, which I do actually.
Well, we appreciate that.
Yes. Does this temporary benefit cover all co-pays for medical care associated with COVID-19?
Yes, so there's no member cost sharing. So, and it's important now at the beginning of the year for this to continue, because a lot of plans reset the deductible on January 1st for people that pick their health insurance plan, say in open enrollment in the fall. That deductible resets on January 1st, and the cost of COVID treatment could go into the tens of thousands of dollars, depending on how long the patient is hospitalized. And so what we wanted to do, again, is provide that extra measure of security, no deductible hits, no co-insurance, no co-pays for COVID-19 treatment. We've had more than 55,000 Blue Cross and Blue Care Network members come down with COVID-19 disease and need care. And the cost of providing the waiver for the co-pays alone has been $25 million for our members since March. And so you can extrapolate from that and just see, based on the multipliers, just how expensive the treatment for COVID-19 can be. And so we want to provide, again, that extra layer of confidence and security for our members through the end of March.
That is so great to hear. So which members and plans does this affect?
It affects all members in all commercial Blue Cross Blue Shield of Michigan and Blue Care Network plans. So essentially, if you have a Cross and Shield on your insurance card, this affects you in a very positive way.
How much has Blue Cross provided to support COVID treatment since the pandemic began?
I think in the hundreds of millions of dollars at this point, and of course, with the pandemic still raging across our state, those numbers continue to add up. But since the beginning of the pandemic, Blue Cross has done things for our members, such as waiving the co-insurance and co-pays for COVID-19 treatment, waiving all cost sharing for COVID-19 testing. In the first few months, when all of us were at home and we couldn't even go into the doctor's office, doctor's offices were closed, we waived the cost sharing for telemedicine. We also provided $5 million to physician practices across Michigan so they could invest in building telemedicine capabilities. A lot of doctors' offices weren't prepared to do telemedicine on a routine, regular basis with their patients. In addition, Blue Cross helped health systems across Michigan by keeping our money flowing into health systems. If you recall, a lot of health systems shut down elective procedures. That means they closed down a lot of revenue coming in. We wanted to help health systems keep their operations going, move resources to the front lines, and help those frontline healthcare workers deliver needed care. And so that, combined with a lot more, is the effort that Blue Cross has made to support Michigan during the pandemic. We have a comprehensive report on those efforts available for anybody that's interested on bcbsm.com/coronavirus. That's
great. Thank you so much.
Also, we've paid for thousands and thousands of COVID tests for our members as well. So The pandemic has really impacted Michigan significantly, and Blue Cross is providing coverage in every zip code in Michigan, all 83 counties. We work with doctors and hospitals everywhere in our state. So if you're in the state of Michigan, Blue Cross is there providing coverage for you. We've had members impacted from all around the state. That's unfortunate. We don't want any of our members to use the benefits that we're now providing for COVID. We don't want our members to contract COVID. It's very important that we all, each of us, do the things that we can to keep ourselves and our families safe. Cover your face, wash your hands on a regular basis, keep your physical distance from other people, especially people outside your household. And if you have any symptoms of COVID, it's important for you to isolate yourself from your family, from your loved ones, and certainly don't go out to the grocery store or outside your home. If you feel like you might have COVID, stay home, monitor your symptoms, and then use telehealth services to connect with a doctor and talk about it.
Absolutely. That's great advice. Thank you for sharing. And if someone wanted to go get a test, they could go to their local primary physician and the insurance would cover it, Blue Cross?
Yes, the insurance is covering testing. We're covering, again, the member cost share associated with that testing. And people that are looking for how to get a test should contact their primary care physician, or they can go to the state of Michigan's website on coronavirus and find a testing site nearby where they live and work.
This is all great info. Thank you so much, Andy. Is there anything else you would like to add that I haven't already asked you, or just you want to add?
No, only that we're encouraging, once again, everyone in Michigan to take the precautions that they can, to use the skills that we've learned since March on how to avoid getting sick. It's really, really important right now to keep ourselves, our families, and our communities healthy. So let's take the responsible steps that we can take. Blue Cross has a lot of information online for any of your viewers to access on our corporate blog, mibluesperspectives.com, and also on our .com site, bcbsm.com/coronavirus, a wealth of information for people to access, learn more, get their questions answered.
Again, thank you so much, Andy. It was a pleasure to have you.
Thanks, Lauren. I appreciate being with you and your viewers today.
Absolutely. This has been Lauren Shields, Fox 47 News.